Hi there, I'm Dr. Bobby Chhoker, cosmetic and implant dentist based here in Sydney. Come on a journey with me as I show you behind the scenes in my life and in my clinic. Recently we're out with friends having a meal, and one of the topics of conversation that came up was medical tourism. It's basically going abroad to have your medical needs met, whether it's dentistry, plastic surgery, medicine. Now, I can understand why this would be very attractive to a lot of Australians, because not only do they get a holiday, but they also get their treatment requirements met at a reduced cost. However, there are some disadvantages and pitfalls. Today, I want to take you through a case study which I really felt for her in the situation that she ended up in.
I'm Samantha, and I guess I came to Dr. Bobby to be restored from pretty much a disaster. I had an injury and quite a lot of infection a few years back, and it caused for me to lose both of the teeth that were existing, the two molars. And I was heading off to travel anyways, and I was going to India to as an artist to do some research, and when I landed there I found a dentist just around the corner from where I was staying, and she seemed lovely, and I just seemed to think that everybody's just as good as everybody else. So I took the chance. I trusted, I believed, and I thought everything was fine, and it wasn't. So I'm back to square one. I mean, financially, in the end I think I spent a hell of a lot more than I would have basically spent if I had just started from scratch here in Sydney. It's been over 5 years of complicated trauma in that area.
Samantha came to me probably about a month or so ago. She was getting symptoms from the area, so asked me to investigate. I took a 3D scan of the area, which you can see here, and I pointed out to her immediately what was going on there. Unfortunately, in this case, what's happened is that the dentist has attempted to put a bone graft in. It's only a tiny bit of bone at the base of the sinus. This is the sinus here. Okay, and this thing that's gone pretty much the entire implant, about 15 to 18 millimeters of implant, which is one of the longest implants I use, is all completely in the sinus. And not only has this been done once, it's been done twice. So she's having to actually have an additional 6 smaller procedures as well as the 3 bigger ones, simply because it wasn't done in the right way in the first place. So unfortunately she's been through quite a bit when she really didn't need to. Again, as I say, I understand why people go abroad, but you need to be very careful. Number 1, make sure your clinician is adequately trained and has the right amount of experience and is in the field of what you're trying to achieve and the surgery that you're going to have. Number 2, make sure that the surgery has the right level of cross-infection control. This is really important. Insist on going to walk around the surgery and seeing the back end of it, not just the flashy front end of it. Have a look at their protocols and procedures. You are putting your life on the line here. You want to make sure that you're not going to get an infection or contract some form of disease. Number 3, make sure you read the contract very carefully. Change the contract so it's adapted to your needs, not theirs. It's meant to be protecting you, not them. Number 4, make sure that you have some form of money back guarantee. And finally, make sure that you have all remedial work covered and a warranty for the work. And that should incorporate the inconvenience of you having to fly back to have it done. So they're the main things that I would look at before traveling abroad. If you are considering it, at least take the time to come in so that we can actually at least discuss, and you've got a marker to see what it would cost and what is involved and what the outcome should be. So at least you've got the right plan of action, and then comparatively you can have a look. My view is this is your body, it's important, and it's better to have things like that done where your surgeon is accessible and accountable.